Good afternoon. I'm Dr. Mike Wilde, Vice President Medical Officer, Sanford, Sioux Falls. Thank you for joining us today. It's certainly our hope the need for these updates is coming to a close. Yesterday marked 10 consecutive days where the number of active COVID cases has decreased in this area. We've seen this before. This past summer, the state of South Dakota was down to less than 200 active cases at one point. We currently are just above 20,000. Only to have new variants come and take cases higher than they've been, as we have just seen. That's why we continue to encourage people to get vaccinated and a booster shot. By getting boosted, you will significantly reduce your chances of getting severely ill and hospitalized due to COVID, and in turn help our hospital capacity. If you've had COVID, it is recommended you get vaccinated and boosted. The data is more clear about our body's immune response to vaccination with booster. Going into the pandemic, we had very limited data on our natural response to viruses that cause colds, such as the adenovirus or the coronavirus, along with others. The pandemic has stimulated much study into our body's immune response. However, we still don't have strong conclusions to guide us regarding natural immunity. As I've stated several times, the less SARS-CoV-2, the virus that causes COVID, replicates or spreads in humans, the less likely it is to cause further variants of concern. We know getting vaccinated and boosted reduces the spread in humans. As it pertains to testing, our laboratory team recently completed its 1 millionth COVID-19 test. That is an incredible number, considering the testing began probably around April of 2020, nearly 2 years ago. There have been many times during the pandemic the team worked around the clock to get people their results, and we can't thank them enough for their dedication. Regarding home test kits, if you test positive with a home test kit, consider that a positive test. You do not need a confirmatory test. That will help reduce our need to run as many tests and prevent you from having to arrange for us to do a test, get tested, and await the results. We are also asking you to not come to our emergency department just to get tested. Please use emergency departments if you have emergency needs. Although we have had some reasonable February weather of late, we know many wish to travel to warmer areas this time of year. Have a great time. But please follow CDC guidance regarding travel. This includes masking with the best masks available to you, keeping away from others as able, and testing as appropriate. Many destinations on arrival or upon return to the U.S. do require testing. I'm aware of people who have had to cancel vacations due to a positive travel test. Your chances of a positive test are reduced by being vaccinated and boosted. COVID really is about the decisions we make or the chances we take. Our chances of getting COVID would be very small if we stayed at home all of the time, never went out. Most of us would choose not to live this way. Most of us have a small chance of severe illness due to COVID. These chances increase with our age, our weight, and our health conditions. Younger, healthy people probably will not get severe COVID, yet some do with devastating consequences, and we have cared for them. Some patients in the hospital with COVID improve in about 2 to 3 days with medications and oxygen and go home. Most will need to be in the hospital for at least 8 days on average. They will need machines to force air and oxygen into their lungs. Their kidneys often shut down, and they will need dialysis. They cannot think or swallow for themselves. We place feeding tubes. Some will survive and recover slowly at home for months. Some do not survive. My intent is not to frighten, but to make you aware of what we work with daily. This is why we have run ads with our nurses talking about this. Your chances improve if you are vaccinated and boosted. Our chances of a future with minimal COVID in our lives are greatly improved with the COVID vaccine and booster. To close my portion, I would like to say once again thank you to all of the healthcare workers. They have worked hard for all of us for the past 2 years. It has been stressful, it has been heartbreaking, it's been emotional. You appreciate your team, you appreciate your family, and your community. We appreciate the continued collaboration between our partners at the city, the state, and the VA. We are here for you and will continue to support you as we persevere through this. With that, I'd like to turn it over to Dr. Dave Basil from Avera.
Thank you, Dr. Wilde. Dave Basil, VP of AMG Clinical Quality. Numbers at Avera, very similar picture as what you just heard from Sanford. After the first few weeks of January, where we doubled the number of hospitalizations that we had, we peaked about the last week of January and have pulled back 20–30% from there, but we're still considerably higher than at any point in 2021. And so things have leveled off and pulled back a little bit and certainly look better than they did a couple weeks ago. The reproduction or spread rate has also fallen below 1.0, which is that key number for the first time, I don't know, weeks or if not months. And that also provides some optimistic news that the case count may start to decrease a little bit. But we aren't there yet. We still have patients that are dying in the ICU. In fact, last week was probably one of the deadliest weeks we've had on record, with around 25 patients dying from COVID in the last week and half time frame. So now is not the time to let up. Couple items to talk about today. First, in regard to vaccines. A lot of you probably saw in the news that the Advisory Committee on Immunization Practices, or the CDC Advisory Committee, met to talk about vaccinations on Friday. They did reinforce the FDA's decision on Spikevax, which is the Moderna trade name for their vaccine, going to full approval. So that's positive news that now we have 2 fully approved vaccines to choose from. They also went over some of the finer points of who needs to be boosted and when, and so you'll probably see some of those specific guidelines coming out here over the next week or two. Another thing to keep an eye out on over the next couple of weeks is early childhood COVID vaccinations. So the FDA Advisory Committee is meeting on Tuesday the 15th to discuss lowering the age for Pfizer COVID vaccination down to 6 months of age. And so they will be presenting the data from clinical trials as well as reviewing the data and experience of those 5 and older to look at next week. And so after that advisory committee, then the FDA would have to rule on that. The ACIP would then meet and the CDC would have to. So there's several step process, but maybe 3rd week of February, we could see the age range drop again for vaccinations. And I know that's one of the more common questions I get asked by parents is, when can I vaccinate my child? And the answer to that is perhaps pretty soon now. Another topic that we really don't talk enough about during this pandemic is mental health. COVID is having a significant impact on mental health clear across our communities. Many reasons why that is. Concerns about one's own health and safety. Concerns about one's family. Maybe somebody in your family got COVID and been hospitalized. Maybe somebody died and the family's grieving with that. There are a lot of families going through grief for all of those reasons. Concerns over daily things, you know, the change in your social structure and what you can and can't do. Concerns about jobs and finances all add stress and anxiety. If you feel like you may be suffering and you need some help, please reach out to somebody. Some signs that you might need to reach out to individuals include things like using alcohol or other substances to cope. If you're using, for men, more than 14 drinks, women more than 7 drinks a week, or for men more than 5 drinks in a session, or women 3 drinks, That's not a healthy amount of alcohol, and please reach out so that we can help you reduce that down. If you're acting withdrawn, sad, overly anxious, that could be another sign. Also, if you're having difficulty engaging with one's friends or family, maybe you're having difficulty engaging with your coworkers and interacting, maybe your job or your school performance is suffering. Those are also clues that your mental health is needing some help. Also, if you've got thoughts of harming yourself or others, that's a sign that you need to reach out. Avera and Sanford were there to help walk with you on this journey. Sometimes you just can't do it alone. And COVID had put stresses on all of us like nothing we've seen in years. And it's having an impact. Please recognize that impact. Talk to your children about what they're feeling. Try to get them to express their emotions. Get them to talk about what's going on in their lives, because sometimes it's even harder for them to work through some of these issues. So closing thoughts. As always, I want to make sure that I thank the frontline healthcare workers. We've seen a little bit of pullback in the number of cases, but that really hasn't trickled into the hospital where our hospital staff are feeling that relief yet. The hospitals are still jam-packed full, one in, one out. They're still dealing with dead and dying patients on a daily basis, and grieving families and grieving staff members. So still be there with us for them. I also want to thank the public. Over the last several weeks, we've sat up here a couple different times and really asked for the public to step up and help us out one more time to help curb the numbers. And the public responded. We've seen a definite difference in the number of patients that, even with mild symptoms, are staying home, isolating themselves, getting tested, or not spreading it on to others, getting their vaccines, getting their boosters, looking at social distancing, the choices that we make, as Dr. Wilde said. It's had an impact. That is why we are seeing this leveling off and why we see some hope on the horizon. So thank you to the public for that, and please stay with us a little bit longer, because if we go back to not worrying about things like that, we could see numbers start to rise again. Help us take it the rest of the way back down. Things could look really different here, as spring opens back up. We could see numbers really fall if we just keep at it. And so with that, Dr. Wilde and I will take any questions. Thank you.
We've seen a number of states now loosening their restrictions across the country. Obviously, we don't really have to worry about that here in South Dakota, but at some point, what they're saying is that we're just going to have to learn to live with it. Is that something that the health professionals will ever say, and what will that look like? So
I do think that COVID is going to be endemic and not pandemic here, hopefully within the next few months, which means that there will be a certain low level of COVID around, like there is influenza. I think that's the most likely possibility. The intent is getting the number of cases down to where it's not overwhelming our hospitals, and so that we can continue to take care of the bread and butter things that we see every day in, day out, the heart attacks and the strokes and everything else, and that we can all go back to a somewhat normal life. I think certain things are certainly going to change in the future. I think we're all going to be more aware of when we have mild level of cold symptoms and have to judge that against how much circulating COVID there might be, the same way as during flu season. You might pay a little bit more attention to cold symptoms that might be influenza. We're going to have to, as a public, we're going to have to watch and know how much COVID is circulating in our communities at any given time. But I think that level will drop down considerably lower than what it is now. Think kind of like last summer when things, there was still a little bit of COVID around, but it wasn't that overwhelming impact on everybody's day-to-day life like we have today.
So educating the public in the process.
Right.
We start looking for certain things. We need to take precautions when that happens.
Yep, absolutely.
When it comes to vaccines for kids under 5, do you, as hospital systems, are you expecting sort of an influx of demand for vaccine? Or are you kind of, I just know a lot of parents of young kids have been kind of anxious about this for a long time.
Sure.
Present company included.
So the question is about vaccination for younger kids, emergency use authorization for those under the current age cutoffs. And we would anticipate, we saw this with the other vaccines as they rolled out to younger people, is it kind of follows your parents' preferences. And so we'll have certainly people lined up right away, and that's wonderful. We certainly want to encourage that. And I think the kids will obviously, especially at that age, will have be influenced by their parents' choices. And hopefully, again, the things said today between myself, Dr. Basil, and through the last several weeks, and messages through our media partners as well, have gotten out the importance of getting vaccinated. And as able, we certainly would endorse that.
I guess for Avera specifically, are you guys, as pandemic or as COVID cases continue to drop, are you guys considering changing how many visitors that you're allowing into patients' rooms, even if they are non-COVID cases?
Yeah, so Avera did tighten up their visitor guidelines a few weeks ago when the numbers really started climbing, and that is something that we continue to adjust based off of how much circulating virus we have in the community, trying to keep our workers safe. So just a few weeks ago, we had close to 500 workers who were out with COVID, either symptoms or a tested asymptomatic positive. And that's now dropped down to under 100 for the first time in a long, long time. And so we will continue to look at the amount of COVID that's circulating in the community as well as in our workforce. And when that drops down to a sustainable level, we'll probably loosen back up visitor guidelines again. Because we talk about all the many sacrifices that everybody's been doing during COVID. Having a loved one in the hospital with COVID and not being able to see them as much as you would like as a family member is horrible. And we're trying to balance that against, keeping our workers safe and at work and not spreading it to others in the hospital. And so as that number drops, we will open back up. I don't have a timetable on when that is. We'll just continue to follow the numbers.
On that, I kind of wanted to ask about the future of data and the numbers and reporting. We've seen Iowa is going to get rid of their kind of statewide reporting. Obviously, the CDC has their own. We have one with the state. You guys have your own health system. As we move into this next phase, whatever it is, what is the future of COVID data and tracking cases versus cases at home and hospital? Can you kind of just touch on everything that goes with that?
Yeah, I think the data tracking is the question was really about MDET and having it be endemic as well. Is what does that look like going forward? I'd anticipate we're gonna, and we meet both ourselves and Avera meet with the state, and we'll be following very closely their guidance, and they're going to be following CDC guidance as well. Could it evolve into just tracking hospitalizations, not necessarily reportable illness for anyone else that tests from an outpatient standpoint? Those are possibilities, and certainly we've all recently adjusted reporting based on state guidance, some subtleties with hospital capacity, because we work with them very closely, and we want to paint the most accurate picture, but also inclusive of vulnerabilities that we have, and but yet put an accurate picture out there about beds available as well. So I anticipate there will be some changes as we go forward, and that's really what we saw with proposed changes in Europe around restrictions and maybe some other states is people are, I think we're going to see some big changes here of late. As scientists, I think we're going to take advantage of that to learn off of that, because some will be doing it one way, some another way. And we saw that recently with, evidence around lockdowns and shutdowns, and, there's always continued masking evidence and things like that as well. So we'll continue to learn and try to guide what we know is best. As people have often said, science is not yes, no, it's not factual, it's try to get the most correct to really guide us all and to safely go forward.
Question on the mental health component that you mentioned. Do you have any sort of data, tracking? Have you seen an uptick in, patients at behavioral or at the addiction treatment center? Is it sort of
Yeah, there is no doubt in the last 2 years we've seen an increase in mental health requests of all types, whether that's inpatient hospitalizations, whether that's outpatient visits, whether that's crisis evaluations. All of those numbers have gone up in the last couple of years compared to what they were pre-pandemic. Right now we're in the midst of building an addition onto the Avera Behavioral Hospital because of that significant demand, and so when that opens, that'll even further allow us to care for that population, and unfortunately it's a real need, and we'll probably fill that the day it opens.
I'll add to that if I could, around mental health, and I was just reflecting on, we certainly saw evidence and studies released, I believe it was in the summer or fall of 2020, around substance use, mental health exposure, and things like that, national data. It really seems, and this is now anecdotal, but as cases go up with COVID, lagging behind that tends to be mental health concerns that we see within the hospital. And it also involves substance use, it involves violence towards staff. And that's really, I think, one of the main reasons why we like to get messaging out about taking care of yourself. I think Dr. Basil did a very nice job about seeking help. If you have questions, issues, concerns, reach out, because we're seeing some fairly significant impact in our hospital currently with our staff, and we really want to try to protect those who are trying to help you.
I was supposed to ask for one of our producers about long haulers. Is that a concern yet? Some people still dealing with long after they've been first tested positive?
Yeah, so the question is around long COVID, and absolutely that is still, again, following the science, that's still being looked at, certainly still see it. I think the best analogy is, if you can recall, prior to the pandemic, anytime you had a cold, you didn't just recover and were great. You kind of had that lingering, and over time you got better. We're seeing that with long COVID. There was data just out recently. The symptoms are incredibly what we call subjective. There's not tests, there's not scans that we necessarily do, but people feel exhausted, fatigued, headache, muscle aches, cough, shortness of breath, and so we certainly do see that in certain people. Tends to correlate with the severity of illness, but not necessarily. The best way around that is to get vaccinated and boosted, not get COVID in the first place. If you do get COVID, hopefully a more mild case with less risk of having the long COVID, but we certainly still see it.
If not, as always, thank you guys so much for helping get the word out there about all these things. It's critical, important, and you're a critical part of that public health infrastructure, and we appreciate it. Thank you.